You're tuned to the Indraprastha channel of All India Radio Delhi, broadcasting on medium wave 366.3 meters, corresponding to 819 kilohertz. Please stand by for the next program.
This is All India Radio. You will now hear comments from the press. The Statesman, in its editorial titled Bengal in Crisis, writes, "Hospitals must function." Comments, "This is the very least that the sick and the dying can expect from a government that has been floundering in its quest for a prognosis and cure in the health sector after close to a week. West Bengal today bears witness to a crisis that has never arisen before. This is shameful enough, and Dr. Bidhan Chandra Roy must be spinning in his grave over this travesty in terms of the Human Development Index. A hospital can scarcely be compared to Nandigram or Singur, and the mounting unrest lends no scope for showboating by stars who a decade ago were in the vanguard of the movement against the CPIM's land acquisition. Friday's resignation of no fewer than 500 West Bengal government doctors might exacerbate the crisis further, and the system could be rendered still more sclerotic. Whatever transpires at Saturday's scheduled meeting between the governor and the chief minister and the latter's discussion with a team of specialists, the patient must wonder whether a government exists in West Bengal. That skepticism has been reinforced post the mayhem at Basirhat to the NRI's Medical College and Hospital, with the canker spreading further afield. The normally decrepit rural health service has very nearly collapsed, if the heart-rending visuals are any indication. For both the doctors and the government, it is time to see reason and act. The patient has suffered long enough. Since last Monday night, the apple cart of healthcare has been rocked fair and square. Indeed, West Bengal is in crisis. The Asian Age, in its editorial titled AES Government Caught Napping, says more than 60 children have died in the past fortnight in Bihar from acute encephalitis syndrome or AES. Such outbreaks of the disease are said to be commonplace, particularly around Muzaffarpur in the summer. The state blames the death of children under 15 from acute brain disease on hypoglycemia, resulting from high heat, humidity, and no rains. Awareness can help a lot towards controlling hypoglycemia. Doctors are known to have researched the subject and pinpointed viruses, bacteria, and environmental toxins that cause such outbreaks in various parts of the country from time to time. While medical opinion may vary on the causes, the disease itself, and the outcomes, it stands no reason that certain areas have been negligent about tackling the core cause of the outbreaks and trying to stem the deaths that occur every year, sometimes even from consumption of lychee and certain types of beans. Not all encephalopathic deaths are caused by the summer heat, but the point is whether or not the nation is doing enough to create awareness in vulnerable sections of the population in rural areas where either AES or encephalitic diseases are routinely claiming young lives. The Statesman, in its editorial title Maritime Blitzkrieg, writes, "Hospitals must function." Comments, Thursday's attack on oil tankers in the Gulf of Oman has brought the United States of America and Iran on a collision course, 16 years after the US invaded Iraq in its quest for the non-existent weapons of mass destruction. The dense black smoke that billowed from the tankers even 24 hours after the strike conveyed a pregnant message. The risk of a war in the region is now dangerously real. It is more than purely coincidental that the blitzkrieg that is bound to dislocate the supply of oil and gas has occurred during the Japanese Prime Minister's visit to Iran. There is little doubt that Mr. Shinzo Abe is playing the role of an honest broker between Washington and Tehran. It was a geostrategic variant of what the subcontinent would call a surgical strike. Notably, the vessels with cargo for Japan were attacked when Mr. Abe met the supreme Iranian leader Ayatollah Ali Khamenei during a visit that is intended to help ease US-Iran tensions. On closer reflection, the attack on a Norwegian vessel and another tanker in the Gulf of Oman has happened close to the Strait of Hormuz, a choke point for the global oil and gas trade, indeed the bedrock of a thriving maritime economy. In comparison to the situation a year ago, the geopolitical scenario today is as disturbing as it is surprising. The US has jettisoned an international nuclear deal with which Iran has been abiding ever since it was signed by Barack Obama in 2015. Donald Trump, it hardly needs to be underlined, has been allergic to any breakthrough effected by his predecessor. Encouraged by the United Arab Emirates and Saudi Arabia, the US has ramped up the pressure on Iran. The